In order to get your patients better and have them seeing good health, doesn't that necessitate understanding what even is health? This is a question a lot of people gloss over. They don't really think about because when we look at somebody and see them as healthy, we just see them as healthy. We don't really think much deeper than that. And so we're making this comparison game in our head, but there are ways to define this. There are ways to look at this that are going to be really helpful for you, that are going to start to change your vocabulary, that are going to give you a deeper understanding. And so even though this is seemingly on the surface a basic question, we think it's really important to understand this. And I'm not going to spend a lot of time going into it. I've done a lot of thinking on this. And I'm just going to give you the highlights of what I believe health to be, because I think there's a counter narrative. There's a clear misunderstanding of what health even is. In the United States, we see that we're spending the most amount of money per capita while getting one of the lowest performing countries in terms of life expectancy. And we are underperforming under some third world countries. So we are not doing very good in this regard. Our life expectancy is significantly lower. And yes, our healthcare is more expensive, but that really doesn't account for the margin of difference that we see there. And in addition to that, you might say, well, health span is better. It's not. We see a rise in prevalence of chronic disease and chronic symptoms across the United States. So what is health? I've gone into a room before to ask this question, and you often get a response like this. Health is vitality. Health is no disease, energetic, happy, pain-free. Furthermore, when you go to Britannica Encyclopedia, they define health as bad health can be defined as the presence of disease, good health as its absence. And then the World Health Organization, many aren't fans of, and that's totally fine, but their definition of health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. They modified this some years ago because before it said just absence of disease. Now they say it's a state of complete physical, mental, and social well-being. While that sounds really nice, I think it's a load of crap. So my primary issue with these statements is that it's focusing on the state of being, the happy, the disease-free, the energetic, which really is the byproduct of health. Health is something deeper. And so what we want to do is we want to understand the elements that create health. That's why you're here. That's why you're going to a testing company. Not so that you can say, hey, you need to be happier. It's like, what are the contributors to being happy? What are the things this person needs to do? What are the changes that they need to see? The elements that create that byproduct. And so that's what health is. I have some definitions for you, but we want to get down to that level of depth where we understand the thing that creates the byproduct we're looking for, not just thinking of the byproduct itself, even though that's the outcome that we want. Health is seen in the relationship between the person and the environment through time. This is my definition of health. Unfortunately, it requires more explanation for me to go into, but basically you have the environment and you have the individual, those two elements. And so health is not within the individual because absent of the environment, you just have the individual. And then obviously it's not just the environment, it's actually the relationship, the thing in between. So you've heard the analogy, when a tree falls in the woods and nobody hears it, did it make a sound? Well, the correct answer to that is no, it did not create a sound. Why is that? It's because sound necessitates a source and a receptor for it to be sound. Otherwise, it's just waves going into the earth. It doesn't mean anything. And so when we look at health, we have to understand that it's this relationship between the two things. And you don't need to go deep into this, but I just want to mention this real quick. And so the issue with this, though, this state of being kind of thought, is that it puts the focus on the disease state, the outcome, rather than the underlying characteristics and traits that manifest into chronic disease. So in the case of a cancer diagnosis, we might eliminate the tumor, but 20 to 55% of people get cancer again after remission, and up to 90% gain an unrelated chronic disease. So the cancer may have been removed, but it didn't necessarily equip the patient for good health. What we want to understand is, what are the characteristics that prevent that person from getting cancer again? What are the characteristics that prevent that person from getting an unrelated chronic disease? Those are really the things that we want to understand more than the cancer itself, is what are the things that create. So what do great medical providers do differently? They use frameworks that allow them to look deeper and see the core of health. which we can't entirely see, but we can get an understanding of it so that we can drive the outcomes that we're looking for. And so if we're just playing whack-a-mole up at the top and the outer layer here of cancer, autoimmune, and cardio disease, welcome to the party. You're doing every what everybody in conventional medicine is already doing. They're looking at those outer manifestations, doing symptomatic coverage. Some people go a little bit deeper, but what we're trying to get to is the core of health. So this necessitates a framework in order to be able to view the core of health. You need some way to think about this that allows you to understand it. And so that's what I'm going to be setting you up for right now. Alex is going to be going deeper into it, but I'm just giving you kind of the basic concepts here. But before we get there, how do we even observe health? You're looking at biomarkers, you're looking at different things, you're getting involved in testing, but what does that even mean? Well, everybody in the world, whether this is a patient applying a therapeutic at home, the worst doctor in the world, and the best doctor in the world, uses a process that goes like this. We have the individual, then we have data collection, then we translate what that means, then we have a perceived health, how we perceive that person, and then we apply an intervention to that individual. So everybody from the worst doctor in the world to the best doctor in the world uses this. The difference being the data collection, the translation, and the intervention, the perceived health and the interventions used. Those can all, on a sliding scale, go drastically different. So data collection doesn't just include biological data such as metabolomics or microbiome or genomic data. That can be you eyeballing somebody. That can be a physical assessment. That can be a nutritional assessment. Data collection happens in a lot of different ways. It even goes into emotional and spiritual contexts. Those are all forms of data collection. But then we have to take that data and say, well, this is what that means to me. And so I perceive this person's health as such. Because if I just told you, I'm going to talk about it in a minute here, this person's C-Pox biomarker is on the high side of normative. What would that mean to you? Right now, it means nothing to you because you don't know what C-Pox is. So you need a mechanism to translate that in a way of thinking about it that gives you a perception of that person's health so that you can make a recommendation. But this is what often happens. And this is the issue that I've seen in the industry so much with over a decade of experience, thousands of hours on the phone with clinicians, going to all sorts of conferences. And this is the issue that I see to be the most commonplace, is that certain physicians will have very fragmented views of what health is or what data is and the relevance of that data. And so they kind of have this fragmentation where it's like, oh, methylation, and this is kind of what the physical means and the toxin, but it's not put together in a holistic ecosystem that they can really drive it through and get a deep understanding of that individual. So what ends up happening is they sequence a few methylation genes. Their assumption is that methylation is the primary source of dis-ease, and then they have a fragmented, and it could be a problem for that individual, but they're overfitting it. They're saying it's more relevant than it actually is, that methylation is their primary issue, and we really need to fix that. It might be an issue for the person, but again, that's creating the fragmented view of this individual, which is going to cause incomplete or inaccurate interventions. Because if I sequenced a few methylation genes and I attributed all the issues that person was facing, or a good majority of them, to methylation, then I'd give them methylfolate, is that really going to solve all of what's going on? In most cases, no. And so we can overfit or underfit things. And I have a good point to draw this home. So does anybody know the most important biomarker that has ever been discovered? You know, it's okay. I didn't know what this was until more recently. This is a pretty new thing. So I'm going to read some things for you here, but this is C-Pox. I'm not going to bother saying the word here. But in the Journal of Human Potential, researchers stumbled upon the most significant biomarker for human longevity, C-Pox. Initially studied in rare metabolic disorders, the enzyme has now emerged as the elixir of life for its unprecedented ability to extend human lifespan far beyond expectations. C-Pox is a critical step in the production of heme. Heme, as you may know, is not just a component of hemoglobin, it's a universal cofactor in enzymes responsible for oxygen transport, electron transfer, and redox reactions across nearly every cell in the body. But here's where it gets exciting. When C-Pox activity is enhanced, the entire heme-dependent system is supercharged. This amplifies a cascade of benefits that ripple through nearly every major system in the human body. Number one, they get optimized mitochondrial energy. Elevated heme levels enhance the mitochondrial electron transport chain, creating unprecedented ATP production efficiency. Cells can now maintain optimal function under stress, drastically reducing cellular aging. Number 2, it gets enhanced detoxification. So heme-dependent enzymes become hyper-efficient, clearing toxins, metabolic byproducts, and harmful xenobiotics. Chronic diseases linked to toxin buildup, like cardiovascular disease, diabetes, and autoimmune disorders, begin to fade. Number 3, antioxidant superpower. Heme is central to catalase and peroxidase activity, which neutralizes reactive oxygen species. Enhanced C-Pox activity essentially eradicates oxidative stress, the cornerstone of aging and chronic disease. And by the way, it's talking about chronic oxidative stress, not just oxidative stress, because we need it. But the most astonishing aspect of this discovery is how easy it is to boost C-Pox levels. Researchers found that consuming fermented black garlic extract, a natural and inexpensive supplement, can elevate C-Pox activity by up to 300% within just 3 weeks. So imagine this world where C-Pox activity isn't just a health goal, but a societal standard. With scalable interventions, humanity could see lifespan extend up to 120 years as the normal. This is the most important biomarker ever discovered. As the normal, healthcare costs drop as chronic diseases evaporate, and unprecedented levels of global productivity and vitality. So this is just this really incredible biomarker, and I have an opportunity that I want to share with you guys. So for $19.99, you can get started on the most behemoth, giant, colossal, borderline disrespectful sale ever. You can get into the C-Pox Society and live to 120 years old. Obviously, this is a joke, as you can see now. I put a bunch of goofy stuff on the screen here. But the point that I'm drawing here is everything I said about C-Pox, which, by the way, is just this obscure biomarker that has little relevance to human health. But everything I said biochemically was accurate. It does all those things. So what I did is I overfit the relevance of C-Pox to human health. So overfitting is when you say, wow, this here's all the different things it does, and then I just make it seem like it's a really, really important thing. But this happens so often at conferences, podcasts, you name it, where we get a really good narrative about what something is doing, or methylation for that matter, is important, but it is often overfit as a primary culprit when it's an element. It's an element that we do need to work with, but it's not the primary culprit. And so when we lack a framework, we start to overfit things and we start to underfit things. And so that's really the importance of this. So we have information and then we take that through incongruent beliefs when we don't have well, everybody has a framework. You have bounds that you operate within, but it's inconsistently applied. You take and grab and use things when they seem necessary, but it's very inconsistent. And I'm not saying everybody is in this camp. I'm just drawing the point with the best and the worst examples here. But incongruent beliefs, what that ends up sounding like is, well, that person had a really convincing narrative. It sounds right and seems to make sense. So let's go for it. So we get convinced by these narratives because it can be biochemically sound, but overfit or underfit. And on the flip side of that, we look at supplements that have been around for a long time, niacinamide, omega-3s, oftentimes become less sexy, right? They're just not the novel thing, the new thing that everybody wants, but they're things that are just wonderful for human health. And so we still have to have that framework that allows us to say, this is relevant because of this, or this is irrelevant because of this. And it's not going to give you all the answers. You're not going to be God after this, but it's going to give you some concepts that you can take forward and become a better clinician with. So this framework is really, really important to understand what you think, because like I said on that have on here where incongruent beliefs and then down, I don't think that fits with my ideas that I don't even understand. That's a really scary place to be, right? You want to be able to articulate what you think. You want to be able to put information through that framework. And so you need to get trained on these things. Otherwise, it can be difficult when you don't have a framework and a rubric and these different things to push things through. So here's our methodology just to kind of set you up for how we think. We look at the individual and we do the same process, but we just have input some of our own things here. So we look at the individual through the 7 data pillars. We have SPAR, which is the translation. So that's stability, plasticity, adaptability, and resilience we see as the primary cornerstones of human health. So if we can get indicators of those 4 things, we get really accurate prediction of where they're going. And there's things underneath that, like you would have aging, and then under aging there would be autophagy that I'm going to get into. But that SPAR, that translation, that gives us a view of health, and we have a more dynamic understanding of what health is. We don't see it as something that's static, a state of being, somebody that's vital, disease-free, pain-free, etc. We see it as somebody who regenerates, somebody who heals. Verbs are really important to use in this perspective. So we look at the propensity for somebody and their ability to take assaults from the environment, their ability to be stable, plastic, adaptable, and resilient. And then we do digital twinning, which is basically our way of speeding up of what interventions are going to work for this person. It's a really cool tool that we're going to show you in this course. And then we have the intervention that we apply and our whole methodology for that. So that's how we view this. So just real quick, and then I'm going to jump into what multiomics is, because that's an important element to understand. And again, I'm just setting you up for the conversations later in this to give you the basic understanding of what these things are. So how do you know a framework is valid? And I highly encourage you guys to test us against other people. So if you want to test us against functional medicine, test us against other labs, what have you, I highly recommend you do that. How do you do that though? Well, one, I want to get rid of this idea of validation as being a distinct finite line that once you cross it, you are now valid, and if you are not over that line, you are invalid. Validation exists on the spectrum, so it's either more valid or less valid. There is no such thing as a validation. Sometimes we draw lines in the sand that are arbitrary based on what things exist in the market, but it's still arbitrary. So it only exists on a spectrum of more valid or less valid. So there's range of accuracy and how accurate these different frameworks are. And then how do you know the accuracy of something? How do you predict the accuracy of something? Well, you look at its ability to predict the outcome. So in the case of SPAR that we're using, it's when it makes a prediction, how often does that end up being the case? Assuming that things continue in a fairly linear pattern of the person is keeping consistent mostly. So we track the desirable outcomes to determine how well something works. If we're just talking in lifespan and health span, which isn't it's just an example so that you can understand it. Something better would be in a shorter window, right? Because you don't want to wait 40 years to see if this framework works. But just as an example, let's say lifespan, we can predict lifespan to be 80 years old and they end up being 78. Pretty accurate. We predict 82 years old, they end up being 78 when they pass. Pretty accurate. What you wouldn't want to see is that generally it's inaccurate. So we predict they're going to be 96 and they live to 72. And you can do that same thing with how likely is this person to manifest a disease or symptoms or what have you. And so the prediction of the framework is what tells you if it's accurate or not. But now we need to get into multiomics, which is a very exciting subject. This is about the data that we are using to inform things like SPAR. So how do we get to SPAR? Well, we need a lot of data to inform that because we need to understand function. So multiomics is really about making the bridge of all these different data sets that exist that I'm going to show you and making sense of them, making sense of human biology. And that's our mission as a company, is to give people access to their own biology in a way that's meaningful, in a way that's understanding. And so let me get into this. From measurement to meaning. So how do we create meaning out of a measurement? Well, it goes from a specific biomarker, such as glutathione. Then we have a functional process. So this would be cellular senescence in this example, which is autophagy and things of that nature. Program cell death, essentially, and how well we are doing within that spectrum. And then from there, we construct a domain. We look at based on the senescence and the things that are happening, which is based on glutathione and all these other biomarkers, we think that they're aging at a rate of X. But there's a need for multiomics because we have 20,000 and these are just rough figures, so don't hold me to it, but 20,000 genomic biomarkers, 20,000 RNA types, 100,000 proteomic markers, 25,000 metabolomic markers, 10 to 100,000 distinct species within the microbiome, multiplied by potentially thousands when factoring strains. So 215,000 distinct biomolecules and species across the layers. So do you think that your labs that you're pulling that are looking at 14 different things are really giving you a good view of function? They're helpful. They are good, but what's better is when you integrate all of these things and you get a really clear picture of what is functioning, what is going on. So current labs usually will look at a subset of a layer. So they'll look at components of genomic data. They'll look at components of the RNA. They'll look at components of hormones. They'll look at components of microbiome metabolome, but they're not really giving you the whole layer. So there is the omic. So metabolomic is just referring to, hey, we're giving you a picture of the whole layer of metabolism, or as much as possible by today's standards. Right now we're at 68%. We're going to bump that up to almost 90% end of the year. But so omic is just referring to that. And multiomics is when we take all of those layers that we have the full sequence of genomic, we have whole genome sequencing, we have the full layer of the RNA, we have the full layer of the proteome, and we integrate all of those together. And why would we do that? Because our biology does not operate in single layers. So when you're looking at function like cellular autophagy, it doesn't happen just in the proteome. You are not genetics. You are not RNA. You are not proteins, and you are not metabolism. You are more than that. And so when we start to construct a picture that puts all of these in symphony, we start to see a better understanding of function. So multiomics allows for a full view of function, paving the way for accurate and precise insights. And that's what multiomics is. It's this big topic that is pretty much reserved in academia right now. And as far as I know, we're the first ones on the market making an actual full multiomic integration. People will say multiomic, but they're grabbing a few biomarkers out of the proteome and a few biomarkers out of the metabolome. Again, omic refers to as much of the layer as we can possibly do. So that is a translayer communication that's happening, but it might not be multiomic if you're not looking at the whole thing. So that's a lot of data because, again, 215,000 distinct biomolecules once we have all of that integrated. And this is where we're going as a company. In this course, we're primarily focusing on the metabolome, but this is a foundational block for, as a practitioner, you're going to be working with us over the years where we're going, and you're going to be able to compound your information over time and your understanding of biology. So pretty exciting. So it gives us a good view of function. So where is Theriome going with this? I alluded that we're going to be doing multiomics, that we're doing the multiomic integration, and that we're going to be kind of dragging you deeper and deeper into this, hopefully over time, where we're very symbiotic. We work really well off each other. We're providing you really good data, and that is equipping you as the best physician in town. But what does our future look like with you included? Well, what does the printing press and the internet have in common? This is a little bit of a generous correlation that I'm giving to us, but these two things, one, they revolutionized the world, but they didn't change the information immediately. They didn't change what was currently out there. What they did is they uncorked the bottle and they broke the bottleneck so that more information could be dispersed to more people. And so all of a sudden, people had access to all this information, which revolutionized the way the world worked. And so we, in the same way, kind of think of ourselves as potentially uncorking what is held by the academic and the medical institutions, where they are they are the ones that determine what is medicine and what is not medicine. And so what we want to do is we want full multiomic integration, zero bias towards the interventions that are used, but we really want to get to the point that we're identifying what's going on in people's biology, what is the root cause of things, and what are the interventions that are going to be the most effective to them. So all we're trying to do is break open the bottleneck of information. We are trying to deliver information to people. And so the method by which we plan to do that is have the most robust data set in the world using full multiomic integration, zero financial gain from the interventions, effectively eliminating bias. A lot of people, pharmaceutical companies as an example, right? They're very biased towards the interventions that are used, and they're going to drive that into the training, into the universities, and try to get as many doctors using their stuff as possible. Well, we want to prevent us from becoming a similar thing. So we have dedicated ourselves to never having any financial gain from the interventions that are used. Number three, health data is owned by the end user using blockchain technology. This is kind of an interesting concept. So, how does somebody give us their blood? We see, we do an analysis on it, and then they actually own all the data from that. Well, blockchain is a great answer for that, where it's fully transparent. So, every time somebody accesses it, they know who accesses it. And if it's somebody outside of their company, it cannot be accessed unless the permission is given by the end user. So, if the end user decides that they want to sell it to some company, they can do that. We would act as a broker. So some company would approach us. We would say like, hey, do you want to sell your data to this company? It's going to be used for this time frame by these people. And then if they agree to that, they get the profit. And then the company can access the data. But nobody outside of that can. So it's a really cool technology that allows us to have full transparency, full encryption, and very, very secure data where it is virtually indestructible. I mean, this is Fort Knox of health data. And then digital twin technology to identify the most effective interventions. And you're going to learn a lot about digital twinning in this course. So the effect of that is going to be generalized interventions based on financial interests, and the keys are withheld, transferring to precise interventions based on objective data available to the public. Now, that's really, really exciting to me because I am in this to move the needle. I do not want another company that is here to make a buck. I want a company here that is really driving the health of the public, because that's really important to me personally. My brother had cancer. If I had access to some of the resources I do now, maybe he would have been around longer, and so now I start to think of, well, that's really cool. We can do this for other people. Other people will have their brother around. Other people will have their parents around, or their grandparents, or what have you. And so this has real life effect. Real things happen here. And so a little image of a Trojan horse here, but we think of ourselves as a parallel institution. When you are trying to change the way that things are done, you can either reform it from the inside of the institution, or you can build something alongside it that's better, right? And there's lots of examples of this happening throughout history. But the better thing, once you start getting adoption, starts to snowball, and that just transfers into the new thing. So I'm not going to go super deep on, some of our daydreams, but what is really important to me is that we help people. So the question of scale, if that happens to 10,000 or 100 million, I'm happy with either, because I'm doing my job and I'm doing it the best I possibly can. But that's a little bit about Theriome's future. So I'm going to let Alex take it from here.